Hello, and welcome to today's video. We're going to talk about a very important subject for seniors and their families: Parkinson's disease, its early signs, and how to manage its symptoms. Parkinson's disease is a progressive movement disorder. By understanding the early signs of Parkinson's disease, we can intervene sooner and improve their quality of life. So, let's begin and learn more. Section 1. What is Parkinson's disease? Parkinson's disease is a nervous system disorder that affects the body's movement, mainly. It happens when nerve cells in the brain, especially in a region called the substantia nigra, break down or are destroyed. The part of the brain that makes dopamine, chemical that helps to coordinate movement, is affected. As the amount of dopamine gets lower, people with Parkinson's disease may have symptoms like shaking, stiffness, and slow movement. The disease is unique in every person, but it gets progressively worse and might be harder to manage with time. Section 2. Early symptoms of Parkinson's disease. Let's discuss the early symptoms of Parkinson's disease. Those symptoms are individual. There are some universal early warning signs to look out for. These signs are subtle and are usually seen as part of the aging process, but they can be a sign that an illness is brewing. 1. Tremors. The major symptom of Parkinson's disease is trembling, usually of the fingers or the hands. It may start when the hand is at rest, and can be sensed as a slight, steady quiver. This is often called resting tremor. 2. Bradykinesia. Slowness of movement. Bradykinesia, which is slow movement, is also an early symptom. Simple tasks, like brushing teeth or buttoning a shirt, will take longer than normal. As the disease progresses, it will become harder to initiate movement. 3. Muscle rigidity. Muscle stiffness or stiffness of the muscles is one of the early signs of Parkinson's. This can be painful and hard to move, and one finds it hard to move joints in a free way. The stiffness is typically felt in the arms, legs, or neck. 4. Postural instability. Parkinson's disease can change an individual's posture, causing him or her to feel unsteady or off balance. He or she will have difficulty standing up straight and will fall more often. It becomes increasingly difficult to walk and maintain balance. 5. Changes in handwriting. Micrographia. People with Parkinson's typically notice that their handwriting gets smaller and harder to read. This is called micrographia. The handwriting can also become cramped, and it can seem like it is harder to write smoothly. 6. Facial expression changes. Masked face. Parkinson's disease affects how people move and can also affect how people show emotions on their faces. People with Parkinson's can show less facial expression, and this has been described as a masked face. This causes their faces to look like they are not feeling anything, when really they are. 7. Speech changes. Another early sign is a change in the manner in which people speak. People with Parkinson's may speak more quietly, have trouble pronouncing words properly, or sound very flat when they speak. This is called hypophonia and can make speech hard to understand. 8. Sleep problem. Sleep disorder is a common complaint during the early phases of Parkinson's disease. Patients have difficulty falling asleep, perceive restless sleep, or awaken repeatedly during the night. Sleep disorder can lead to daytime fatigue and harm general health. Section 3. How Parkinson's disease progresses. Parkinson's disease progresses. Symptoms become more noticeable. The tremor, rigidity, and slowness of movement get worse, and new symptoms may develop. This stage can make people unable to perform daily tasks on their own. It should be remembered that Parkinson's disease develops at a different rate for all individuals. Some individuals will gradually slow down and remain independent for several years, while others will lose their capacity to function more quickly. Section 4. Managing the symptoms of Parkinson's disease. There is no treatment for Parkinson's disease, but early knowledge of it and symptom management can significantly improve people's lives. The following are some methods of managing Parkinson's disease symptoms. 1. Medication. Medication are generally employed to manage the symptoms of Parkinson's disease. The most prevalent therapy is levodopa, which stimulates the increase in dopamine in the brain. The medication may decrease symptoms such as shaking, stiffness, and movement slowness. Additional medications, including dopamine agonists and MAO-B inhibitors, could be utilized to manage symptoms and retard the disease. 2. Physical therapy. Physical therapy is extremely crucial in assisting individuals in moving more easily and reducing muscle stiffness. A physical therapist is able to design an individual exercise program that focuses on strengthening muscles, making them more flexible, and enhancing balance. Regular exercise can also benefit overall heart health and reduce the risk of falling. 3. Occupational therapy. Occupational therapy is directed at helping individuals with Parkinson's maintain their ability to carry out activities of daily living. An occupational therapist can recommend changes to the home environment and provide tips for doing things more efficiently. These interventions improve independence and quality of life. 4. Speech therapy. Speech therapy is also beneficial for speech problems associated with Parkinson's. Speech therapists can aid people in making their voice louder, pronounce words more clearly, and articulate better. They can also show people techniques to manage swallowing problems, which are a hallmark of late Parkinson's. 5. Healthy eating and nutrition. A balanced diet is essential in controlling Parkinson's disease. A diet rich in fruits, vegetables, whole grains, and lean protein can provide the nutrients essential for good health. In addition, individuals with Parkinson's can have difficulty swallowing, so softer foods or smaller, more frequent meals might be recommended to reduce the risk of choking. 6. Mental health support. The majority of people with Parkinson's disease develop depression and anxiety. Treating these mental health issues early is important to prevent harm to overall health. Therapy, support groups, and medications in some instances can be utilized to manage these mental health issues. 7. Stress reduction technique. Stress can worsen the symptoms of Parkinson's, and therefore, it is important to learn to relax and minimize tension. Mindfulness, meditation, yoga, and breathing exercises are all useful strategies that can help you relax and lower stress. 8. Assistive devices. The disease gets worse. Some people can be assisted by tools like walking sticks, grab bars, or utensils for eating. These tools can maximize their independence and safety. 9. Surgical options. For those who no longer respond to drugs, deep brain stimulation (DBS) can be considered. DBS is the implantation of a device in the brain that delivers electrical impulses to areas that help control movement. This operation has been shown to reduce trembling and improve the ability to move in some people with Parkinson's. Section 5. Living well with Parkinson's disease. Parkinson's disease is a challenging condition, but it is possible to live well with the proper assistance and treatment. Being active, having a positive outlook, and a good support system can control symptoms and make life generally better. Family members and caregivers are extremely important to provide emotional support and help in daily activities. Open communication, understanding, and patience are required to ensure a good relationship. Conclusion. In short, Parkinson's disease is a progressive disorder, but proper detection and treatment at an early stage can greatly help those suffering from it. It is required to notice the symptoms at the earliest, take medical help, and follow a complete treatment course in order to manage symptoms and ensure a good quality of life. If you or someone you love develops any of the symptoms we've talked about today, we encourage you to talk to a healthcare provider. Getting help early is key to living well with Parkinson's disease. Thank you for viewing the video today. We hope you have found this information useful. Please subscribe, like, and comment below if you have a story to tell or a question. Take care and stay healthy. See you in the next healthcare videos.